another category to talk about in ideal candidates is that we typically focus on mild to moderate glaucoma. Um, I have, though, in some cases, had patients who had very high pressures, but their nerves were still pretty healthy, and I didn't want to subject them to getting a trabeculectomy or a tube shunt. And so I wanted to try the trabectome, and I've had good success in some of these more extreme cases of doing the trabectome, knowing that and explaining to the patient that if the trabectome doesn't work, we're going to have to go with Plan B. But in more than, I would say, 60 to 70% of the cases, it works well to get their pressure down, surprisingly. And so the most typical is mild to moderate, but there can be some instances where you have extreme pressures.
What would the extreme pressure be?
I've had patients whose pressures have been in the 40s. And I had one patient, for example, who was a pseudoexfoliation glaucoma patient. Her visual field was almost normal. Her nerves were still like a zero.3, 0.4 cup. And her pressures, I'd been following her actually for over a year, and then her pressure shot up into the 40s, and she was on maximal medical treatment. I did a trabectome. The pressure came down to the upper teens on 2 medications, and she was able to get off her Diamox. And so this is a procedure that can allow for people to still have a good quality of life with lower eye pressure that can be stabilized.